Good afternoon. Welcome to the AANEM Neuromuscular Virtual Fair. We're very excited to have you all join us today. We've got 4 programs presenting tonight. We have Penn State Milton, Hershey Medical Center, University of Florida College of Medicine, University of Miami-Jackson Health System, and University of North Carolina Hospitals. Sit back, each program will give a brief presentation and then we will jump into question and answers. So you'll be welcome to submit your questions at that time. And we will submit questions using the chat. Please go ahead, feel free to ask those questions at any time. They just will not be answered until the end of the session. All right, thank you so much and enjoy the fair.
Well, good evening all, and thanks, Sandra. And then I also have Mrs. Renee Chaisi. She is our program coordinator. She's actually works very diligently. So we do have an ACGME accredited 1-year neuromuscular fellowship program, and we had this for quite a few years. And I will just go over the opportunities that are available. So the first headline is opportunities and proficiency in the following. So we have EMG and nerve conduction study in both adult and pediatric populations, both outpatient and inpatient. We have facilities to learn autonomic testing, use of botulinum toxin, both for headaches and dystonias, skin biopsies for epidermal nerve density determination for small fiber neuropathies. We have adult as well as pediatric neuromuscular clinics. We have a state-of-the-art ALS clinic as well as the MDA Care Center clinic. And we have a very well-established neuropathology service. They provide the training once a week to the fellows. We have neuromuscular ultrasound, which is a new addition, and it's just getting stronger with time. We have opportunities to get involved in research, then teaching opportunities, teaching to medical students, residents, and PMR residents who rotate, and as well as the clinical neurophysiology fellow. We have quality improvement projects. These are all optional, but they are good for the fellows. And we don't have any calls or after our responsibilities, no outreach driving. Basically, our hospital is a mile away within the same campus, and one outreach clinic is also half a mile away, and also fellows don't go to even that outreach clinic, but if they want to go, it's just across the street. Next, I will go with the didactic sessions, and that's particularly, I think, pretty good because everybody likes there. So we have personal and small group sessions every week, several, more than one. We do book clubs. First, we take the Preston and Sapiro EMG book, and once we are done, then we take a neuromuscular disease book or books or monographs, and it's an interchanging session. So the fellows come prepared, and I usually, or whoever is the attending, we also go prepared, and we just discuss. It's an interacting sessions. We have, in addition, the GME core lectures. Those are actually good because sometimes they invite really eminent speakers from outside. We have departmental grand rounds once a week. I would say about a third of those are on neuromuscular issues or somewhat related issues. And we have a QA, question and answer, which is a quality improvement session on EMG once a month. And Dr. Zachary Simmons runs that, and he has been doing this for probably many decades, I would say. And so that's really a good one. That's for the EMG brainstorming. We do have a strong mentoring and supervision program. So every activity for the fellows is a one-to-one. So fellows here do not have their own clinics. They do not do EMGs alone. Fellows do not have any schedules, like they do not have any EMG schedules or clinic schedules. If they're working with an attending, the EMG or the clinic schedule belongs to that attending, and fellows will just chip in. They will take maybe half of the cases or whatever is possible. So one thing is that they take the burden of their head. If they have to be absent, go and attend some dental or medical appointments, or something happens, the clinic doesn't get canceled because the number of patients remain the same with or without the fellows. And we sit where the fellows work, like within the same area, not the same hospital or building, literally maybe the next room. So whenever they're done with the patient, we just go there. And so it is one-to-one supervision for anything and everything. So then we have a formal evaluation process, which probably is pretty much standard nationwide, personal as well as departmental. I'll probably skip the details of that. We have a robust wellness and burnout prevention programs, and I'm the program director, and I'm also the wellness officer for the department. So basically, we have a very robust activity from the institution, which is Penn State Hershey Medical Center, as well as our departmental activities in terms of wellness and burnout prevention. First of all, there is no sleep deprivation, no calls, no outreach clinics, so that's good. And then there is no pressure to run your own clinic, but you have autonomy. When you see patients, when you have EMGs, the attending is just waiting in the next room, so there is autonomy, but there's no pressure. One thing I would mention that we have over the last few years have done a lot of work in updating our gene relationship. So our genetic testing is pretty much like whatever could be tested free or with low cost with several companies through MDA and beyond MDA. So we have developed a very robust genetic testing programs where not only the fellows, but residents, APPs, and the general neurology doctors, they're also well aware of how to order, where to go, where is the kit, which part of the form has to be filled up, where is the form, like everything is easy for an user-friendly environment. And we have gene therapies, almost all the products, gene-targeted therapies, as well as gene therapies that are out there. Those are in use here in Penn State, combining the pediatric neuromuscular and the adult neuromuscular divisions. And we want to grow. We also invite eminent speakers. Like last week, we had an eminent speaker talking on autonomic encephalopathy, but also this month, next month in February, we'll have 3 speakers on neuromuscular topics like that. So our general neurology department, our neurology department is very appreciative of the activities that we do in the neuromuscular division. And we want to grow in as many ways as possible without causing any additional stress or burden in as much of user-friendly ways as possible. We keep an eye on other programs because some of our faculty members, they have come from Cleveland Clinic. I have experience with the Mayo Clinic Health System. So we have several cultures also have blended and our kind of almost Dr. Zachary Simmons has developed this division. So he kind of spearlead the whole activity, but there is diversion, there's diversity, and we appreciate and we acknowledge the differences in ways EMGs can be done or neuromuscular clinical practice can be done, and we incorporate those. Right now we have a great diversity among the attendings, and our fellows like that because they work with all of us. And so they kind of come to know about different schools, the Cleveland schools, the Mayo schools, and things like that. That's pretty much it. But, and I read a lot about how other institutions, great institutions in the country are doing it. And we try to kind of learn from them and try to incorporate those great ideas from other institutions, which I think I will hear tonight, some of them, into our program. So that's pretty much I have. Renee, do you have anything to?
No, I don't think so. I mean, if anybody's interested, like, you know, I know they're recording this, but if you go to our website, we do list our benefits, and we have some information out there for the residents, fellows. We also have virtual tours since nobody's able to come see our hospital during COVID. We do have the virtual tour listed of our hospital. So any other questions, anybody can reach out to us and we'll be happy to answer. That's it.
Thank you.
Okay, good evening, everyone. I'm Miguel Chukiling. I'm an associate professor of the Department of Neurology at University of Florida. I'm going to talk to you about our neuromuscular fellowship. Our program is an ACGME certified fellowship of 1 year duration. We are able to take up to 2 fellows per year. And at the end of the training, the fellow will be able to take the ABPN and AANEM certifications. This is a slide showing our neuromuscular faculty for the fellow. We have Dr. James Weimer. He's our division chief with a special interest in ALS and numerous clinical trials in that condition. We have Dr. Subramani. He's also renowned for his interest in spinocerebellar ataxias, myotonic dystrophy, and periodic paralysis. Dr. Triggs mostly works at VA hospital, but also 1/2 day in our main hospital. He has interest in just neuromuscular conditions, and he has done some research on transcranial magnetic stimulation. We have Dr. Signorello and Dr. Slatky from Pitt's Neuromuscular with interest in muscular dystrophies. Dr. Rivera and Dr. Jagnis are our muscle and nerve pathologists. We do joint sessions to review the muscle and nerve biopsies. And Dr. Gonik, autonomic specialist. Our neuromuscular team also includes, obviously, EMG technicians, nurse practitioners, a social worker, mobility equipment person, genetic counselor, and other therapists. April King is our fellowship coordinator. This is a picture showing, one of the retreats. We had a lot of fun. Some research members are here, and this is the rest of the team. In terms of clinical sites for the fellow, we have 2 main hubs. One of them is the UF Health Neuromedicine Tower that was recently opened in 2017 as a state-of-the-art building. And this location, we have some of the neuromuscular clinics, and also 3 EMG machines, an autonomic testing machine, and also fellow will do inpatient consults or EMGs. Our main hospital is UF Health Shands, just across the street from the Neuromedicine Tower. We will have some inpatient consults or EMGs there. And another hub is the Norman Fixel Institute for Neurological Diseases. This is a brand new facility opened in 2019. Here we have our multidisciplinary clinics, MDA, ALS, neuropathy, myasthenia gravis. We also have a space for research facilities and rehabilitation services. In terms of clinical activities for the fellow, we have different activities. A neuromuscular clinic happens daily. Our multidisciplinary clinics, MDA, ALS, peripheral neuropathy, and myasthenia gravis happen weekly. We have EMG nerve conduction studies. They occur daily and in both facilities. Average of 60 to 80 EMGs a week. I asked, and they told me about 2,000 average EMGs per year. Autonomic testing as needed. This doesn't occur every day. And inpatient consults of EMGs also as requested, about 150 per year. This is a sample schedule for the fellow. We have divided the rotations in monthly blocks. The blocks include adult neuromuscular conditions, electrodiagnostic testing, pediatric neuromuscular rotation, muscle nerve pathology, chemodenervation, Botox injections, and a research or elective rotation. This is an example on the bottom left of a weekly schedule. This will vary depending on the rotation the fellow is in, but it will have a combination of EMG, multidisciplinary clinics, and also some research time, half a day per week. And at the bottom right, we have the weekly didactic schedule. This will include a monthly muscle and nerve pathology review with a pathologist. We also have a weekly EMG and nerve conduction study lecture series, and a monthly journal club and EMG neuromuscular case review, and a weekly neuromuscular lecture series. This slide shows all the didactic lectures. As you can see, it covers the whole spectrum of neuromuscular conditions. In terms of research, we are well-versed in research. We have numerous projects in clinical trials and different conditions, including those listed here, especially ALS, ataxias, myotonic dystrophy. The fellow is required to complete at least one research project, and we provide a stipend for the fellow to present research at one of the neuromuscular conference, AANEM, AANEM, or others. We also have research collaborations with other institutes at UF, including UF Center of Neurogenetics. Here, where it's basic research on ALS and myotonic dystrophy mainly. UF Myology Institute with muscular dystrophy research, and the Gene Powell Therapy Center. research on Pompe's disease, and also Duchenne genetic therapies. In terms of the town, Gainesville, Florida is a small town. It's a college town. As such, I think it has pros and cons, doesn't have all the pros of a big town, big city, but the advantage is you don't have almost no traffic. You can get around 10, 20 minutes to the hospital. If you like sports, on the weekends, you can have, your pick of football or basketball games. It's a livable size, family friendly, very good for kids, and very good schools. And you can go to botanical gardens. You have some nature to explore around, and also farmers market. If you get bored and you say, "Oh, I want to explore further," we are right in the middle of North Central Florida, easily driving distance to major cities such as Orlando in the south, Jacksonville, Tampa, about 1.5 to 2 hours, and 5 hours down to Miami. You can visit beaches, 2 hours on each side. Orlando with Disney and all the other parks, and Jacksonville, St. Augustine beaches there. And then we have also other wetland parks and springs that you can explore. That's it. So you have any other questions about our program, please don't hesitate to contact April King, our coordinator, or myself. The email is listed here. I look forward to reviewing your applications. Thank you.
Great. Okay, I'd like to start with a quick video.
How to stop this?
Hello, I'm Henry Ford, Dean of the University of Miami Miller School of Medicine. Welcome to the University of Miami in Jackson Health System. Graduate medical education is unlike anywhere else in the world. Our partnership in medical training gives you access to unmatched clinical experience, cutting-edge researchers, and innovative educational programs. At the U, we empower our residents and fellows to transform lives, and we inspire them to serve our global community as we train them to become the next generation of physician scientists, transformational leaders, and educators. So if you want to train in a vibrant, dynamic, and diverse environment where you can make a difference in the lives of your patients, your colleagues, your community, and the future of medicine, then the UM Jackson residencies, as well as our fellowships, are exactly where you need to be. We look forward to seeing you at the U.
So the UM Neuromuscular program is a relatively large program. We have 7 full neuromuscular faculty and 2 faculty who are part neuromuscular and part general neurology. They do the EMG. So briefly to mention, we are run by Dr. Benatar, who is a well-renowned nationally and internationally researcher in ALS and myasthenia gravis. Dr. Verma is our neuromuscular fellowship director, and I am the associate director of the neuromuscular fellowship, and I also currently run the ALS clinic. We have Dr. Saporta, who runs our MDA Care Center and CMT Center of Excellence, and we have several other faculty, among which Dr. Carbonar runs our myositis clinic, and also our experienced faculty who do general neuromuscular disorders. We have several specialty clinics that are certified. First, we have a quite large ALS clinic that serves over 250 patients at this time, which runs weekly and full day clinic. We have an MDA clinic, multi-center MDA clinic, which is part of our actually genetic neuromuscular program run by Dr. Saporta, who also is a geneticist. So we provide basically basic lab plus clinical genetic neuromuscular disease care. And we have a separate CMT Care of Excellence where CMT studies are done. We have a myositis clinic that is dedicated to inflammatory muscle disorders. We have myasthenia gravis clinic along with our general neuromuscular clinic for consultations. So our fellows split their times between our clinics and EMG. This is more or less 50-50 depending on the week. There are certain clinics they attend every other week in rotation to the clinical neurophysiology fellows with whom they collaborate. As I mentioned, there are several specialty clinics they participate in, and in between there are, when there is a request, inpatient neurology consultations, neuromuscular consultations, and EMG. The didactic training is also very well structured. So the neuromuscular fellow is expected to run the neuromuscular case conference, which is every other week, where several faculty from within and outside the division participate along with a large group of residents. So this is while preparing the fellows learn a lot. We have a neuromuscular journal club and a neuropathology training, actually before COVID in person and a multi-head microscope right now online, where we discuss our neuropathology cases, and people are learning that way. And we have a very active clinical and basic science research program that I'd like to say a few more words, because we strongly encourage fellows to participate in research, and if interested, we do provide opportunities to stay another year for research participation. So this is where the activities are done. So it's actually in the heart of Miami, in a large campus, as I mentioned. So these 4 locations where the fellows go to see their patients. The base of neurology is the clinical research building. The clinics is where it's located as Professional Arts Center, and our inpatient and EMG laboratories are also in Jackson Memorial Hospital and University of Miami Hospital. So as I mentioned, we have a highly active and well-funded research program. In addition to basic science research that is run again by neuromuscular division faculty, we have a gene therapy development program in CMT, plus a drug development platform. So these are the currently active clinical studies that are run at the neuromuscular division. Again, we're a NeuroNext site, and we participate in all NeuroNext clinical trials, including those that are neuromuscular. We run studies in myasthenia gravis. We're currently running, as a center from here, a CAR-T cell study in myasthenia gravis, and we run several ALS studies. These are the currently active studies. University of Miami is currently the host, is actually the creator and the host of the CREATE consortium, which is run by the data center here in University of Miami. The Department of Neurology, of course, the neuromuscular division is not in a bubble, requires a strong department. It is run by Dr. Ralph Sacco, immediate past president of AANEM and previous president of American Heart Association. There are currently 85 plus clinical and research faculty. It's highly ranked in NIH fundings and active grants. And there are 42 residents and 20 fellows. So it's quite a large program. Therefore, the neuromuscular trainees and faculty are very well supported. Saying about a word in, I guess, being in Miami, because this is very important quality of life. So really being in Miami is, as you see here, is a good it's lifestyle improvement. We are in the center. So where it says Civic Center, it's the center of Miami, very close to Miami Beach and Brickell, which is the downtown Miami. So in addition to great training and research, there is really access to really nice lifestyle. We live where people go on vacation. So we look forward to receiving applications from potential fellows, and thank you for listening.
Rebecca Traub. I'm the program director here for the Neuromuscular Medicine Fellowship at the University of North Carolina in Chapel Hill. So we have a good sized neuromuscular faculty. We typically have 1 fellow per year, and we have a neuromuscular medicine ABPN certified position. We sometimes will have a second fellow for a non-ACGME position, who's still ABEM eligible. So we have opportunity for at least one and sometimes two fellows per year. As others have described, our fellows spend about half their time seeing patients in the neuromuscular medicine clinics and half their time in the EMG lab. And those clinics include subspecialty and interdisciplinary clinics for our MDA clinics. We have a dedicated CMT clinic for our myasthenia gravis, ALS clinics, PEDS, MDA, and then of course the general neuromuscular medicine patients seen by all the faculty. The EMG laboratory training, of course, includes routine EMG and nerve conduction study training. We have good exposure and training in neuromuscular ultrasound, both for kind of straightforward things like carpal tunnel and ulnar neuropathy, as well as some less common studies like diaphragmatic ultrasound. Fellows will have exposure to, and those who are motivated to learn it can have more time doing single fiber EMG, quantitative motor unit analysis. We do pediatric EMG with anesthesia sedation. We work with ENT to do laryngeal EMG. The fellow gets exposure to doing EMG guided Botox. We have a full autonomic testing lab set up, and then of course training in doing skin biopsies for small fiber neuropathy. So our fellow gets exposed to and gains the skills to offer the breadth of neuromuscular diagnostic testing. These are our faculty. So our core neuromuscular faculty, Dr. Chip Howard has been at UNC for many decades and leads the myasthenia gravis program, and now currently is primarily in a research and teaching role. Dr. Vinay Chowdhury will be coming to UNC as the division head in a few months. So he will head up the neuromuscular division and has a lot of experience and specialization in neuropathies. I also see a lot of neuropathies and run our CMT center. Dr. Merabian runs our muscle program, and Drs. Merabian and Gelinas run the ALS program. Dr. Fawn runs our pediatric MDA program and our Spinraza and SMA therapeutics. And Dr. Sklarov heads up our autonomic testing. Our fellows also have opportunity to work with some of our physiatry colleagues, including Drs. Carvelis, Filer, and Shuping, and do a lot of ultrasound with them as well, so to get good neuromuscular ultrasound experience. Here's just some photos of our facilities. This is UNC Hospital. Here is up at the top the Neurosciences Hospital and the Children's Hospital. And so really all the inpatient and EMG lab activities occur within this major medical complex, which is on the campus of UNC in Chapel Hill. This is a picture inside of the EMG lab. We have 5 EMG rooms and a dedicated autonomic room with good space for doing lots of studies and adequate space for everyone to get their work done. This is our outpatient neurology clinic, which is just a couple miles from the hospital and where we see the majority of patients. We have a robust didactic and education program, including a formalized didactic lecture schedule, regularly scheduled journal club, muscle rounds, and nerve pathology so that the fellows get full exposure to the breadth of the material that they need for clinical practice and for board's examination. There's lots of research exposure during the fellowship. Dr. Howard heads up our neuromuscular research program, and this is Manisha Chopra, our main research coordinator. So the fellows can certainly have exposure to the breadth of clinical trials that we have going within the division. And then we also encourage our fellow to do some type of research project during their time with us, whether it be case report or retrospective or small prospective project while they're with us. Full salary and benefits information for our fellows can be found on the website. The current PGY5 salary is listed here, and there's funds for books and meeting attendance for all trainees. And Chapel Hill and the Research Triangle of North Carolina are a nice place to live. These are some photos of campus up here. This is Franklin Street, which is kind of the main college town center of Chapel Hill. Pictures of basketball and football as sports are a big attraction in the area. But the Research Triangle area is just has a very nice quality of life, fairly affordable, lots to do, good restaurants in Raleigh and Durham, and just a couple hours drive to the beach or to the Blue Ridge Mountains makes it really kind of a nice place to live and family friendly as well. If there are any questions, I'm happy to have people email me. So here's my email up at the top. Our program coordinator is Ashley Miles. I listed her information there. Our current fellow who is happy to speak with anyone who's interested, I put his email there as well. And then further information about the program is available on our website.
All right, thank you very much, everybody. Let's go ahead, we'll move into the question and answer period. So looks like we don't have any questions yet. So let's go ahead and jump into the question that I posed earlier. So can you tell residents why you chose neuromuscular medicine?
I think I can go first. Yeah, so actually coming into residency, my idea was to do stroke. As I think probably most med students, or a lot of med students do, because of the localization and all that. But when I started residency, stroke had become more MRI dependent, not too much localization. I mean, there's still some thinking, but MRI dependent. And the impression I got was different, during residency. And what impressed me a lot was my neuromuscular attendings. They were really focused on, the clinical history, the localization, the exam has a great role in finding a diagnosis. You have so many places where you can localize the disease. So the thought process of coming to a diagnosis and localization, I really like that part. And then that was one of the reasons that motivated me to pursue neuromuscular. The other reason was a lot of research that is, being done, and a lot of things that are yet to be discovered, especially in terms of treatment of ALS, muscular dystrophies. I have some interest in genetics, even though I'm not a geneticist. So I always fascinated trying to guess the mutation of the patient, what condition they may have in terms of genetics. So all those two things made me pursue neuromuscular. For the person that's considering neuromuscular, I think it has a good balance between clinical and research and also procedures, because you have the EMG, you can even do ultrasound sometimes, skin biopsies, muscle nerve biopsies, you can read those. So you can have you can pick which area you want to subspecialize more and have a good balance.
Dr. Bandy from Hershey Medical Center, Penn State, and of course, Mrs. Venechaisi was with us. So I personally went to neuromuscular medicine because I was influenced by my neuromuscular attendings. They were both Mayo Clinic trained people, and neuromuscular medicine was the strongest arm of neurology at that point. And then of course I fell in love with EMG and with my personal interest in physics and electronics. So it was a very natural choice for me. But then what I would say, but that was very personal, what worked for me may not be appealing to the residents. But right now, in my opinion, why any resident should consider neuromuscular fellowship would be the gene therapies and the gene targeted therapies in neuromuscular medicine. I think of all the branches, out of all the branches in neurology, neuromuscular medicine probably is the undoubtedly the #1 branch where we are hearing gene targeted therapies and gene therapies are coming out and more to come. And if you look at the studies going on, different phase 2 and phase 3 studies, and some are in phase 1, over the next 5 years, I think the face of neuromuscular medicine is going to be different totally. It is changing, but it will be very much changed so that, in 5 years, if I look back at what I did 5 years ago, it will be a different person. So I tell my residents that look for future. Either you fall in love with something and then you pursue that. That could be headache or MS or neuromuscular medicine. Second could be the situational influence, which happened in my case. The situation just made me into a neuromuscular field. And third, if you want to just look for opportunities of, okay, how can I see myself in 10 years from now? Which branch of medicine is grown? We have seen multiple sclerosis, demyelination, took the previous decade, the movement disorder kind of definitely ruled the previous decade. I think this decade is going to be the decade for neuromuscular medicine in terms of the progress and in terms of the discoveries and the opportunities to provide a meaningful treatment to patients. So that's what I tell my residents at this point. Thank you.
Thank you, Dr. Bandy.
I think a lot of it's being covered, but I agree. Neuromuscular medicine, I think, has the diagnostic. It has the emerging therapeutics, both from neurogenetics and from autoimmune disorders. And it gives you the continuity of being able to treat patients really long-term and over many years, which is really distinct from many other parts of neurology.
I guess I'll add on, although most was covered. It's an outpatient specialty, and for those people who prefer not to be in a hospital setting, critical care and stroke, it's a great option. It's an exploding field, as was said. Really amazing research is happening. And I think also there's a shortage of neuromuscular physicians. I mean, in everywhere. I mean, if you say you're a neuromuscular physician, you'll be grabbed. So I think it's a great opportunity to grow into neuromuscular right now.
The questions that we had the other night that I think was a great one is, the question said, what is one aspect of your program that you would say is your strongest asset or is unique to your program?
Well, I can go because I started. So the answer to this question will actually come from the interviews that we do, the exit interviews of the fellows, the neuromuscular fellows, and what we have done over the last 5 or 6 years. I have asked them, mention the strongest point of this. And the answer from our fellows, the completing fellows, has been that the congenial atmosphere giving autonomy. So this is what I've heard. The atmosphere is absolutely fearless. There is no pressure. And then you learn as much as possible. Everything is there and you have options. So that's your autonomy like that. So that has been the single most cause for the last 5 years, fellows liking the fellowship. And then what happens, this Mrs. Rene Choisy sends a question 1 year after their completion, and they could be anywhere, like Dr. Anahit Mehrabian that UNC, we just saw her picture and name, so she was our fellow. So one of the questions is saying that, would you, given a chance, would you do another fellowship here, or would you recommend a fellowship to another person? And the answer has been yes. So I think it is the atmosphere and the opportunities and the autonomy and the ease with which they learn. We do not have much to offer, like Hershey, as you know, is a safe town, it's a chocolate town, there's a Hershey park. It's well connected with Philadelphia, etc. But it's a nice, quiet life. Not much is happening. But the fellows enjoy the quiet environment for 1 year and to learn, and then they decide whether to stay here or to go somewhere else. So I think they like the atmosphere also. Yeah, that will be my answer. Thank you.
Thank you, Dr. Bandy.
I think I can go next. About the University of Florida, program. We are a relatively new fellowship. We're going to start a new fellow, first fellow actually this July. So obviously we don't have any exit interviews and things like that, but I can assure you that we are dedicated to education. We are we have a small number of faculty, so we can offer, almost one-to-one tutoring and education to the fellow. And we also have ample research opportunities for them. And with all these collaborations with all the institutes, if the fellow is dedicated to research, we can accommodate the schedule to make that happen.
Should I go next? So as physically running this program, I would say, I think one of the greatest opportunities for the fellows is really first being in Miami, being in this strong research program, and getting a lot of referrals, because Miami is the gate to the US from South America. We have a really large referral base, nationally and internationally. But I wonder, our fellow, Dr. Dosani is online. I wonder what her thoughts would be.
Sure. Hi, everyone. I'm so sorry for being a bit late. I just had an appointment prior to this. But yeah, 6 months into the fellowship, I think exactly what Dr. Grant was mentioning, just being in Miami and really a catchment area that goes beyond just South Florida. I think that's huge. And we also work I think it's just the diversity of cases that we see. I think just last week, in addition to just doing outpatient studies in the EMG lab, we get a lot of inpatient referrals. And then just last week, I think we did 3 inpatient studies, and one was a porphyric neuropathy. I've never seen that. Another was classic CIDP case. Another was a critical illness neuropathy. So I think the demand's high. It's such a diverse array of cases that we see, and I think that all is attributed again to being a large a tertiary care center, as well as just where we are in Miami and having that large catchment area. So I think I feel like we get to see a lot and be exposed to a lot. I think that's a huge advantage or plus for me so far.
Thanks, Dr. Dosan.
Thank you.
So I can just say briefly, I think the strength of the UNC program are really first and foremost really excellent clinical training, that our fellows graduate well trained to go out and do both routine and complex electrodiagnostic testing, and to treat the full breadth of neuromuscular disorders coming out of training. I think we have a big referral region as well. There are not a lot of academic hospitals in the region in which we practice. We see the full breadth of neurology and neuromuscular medicine, and see sort of all types of rare and complex, as well as the common. And then I think just the dynamic of the division is really friendly, and our faculty like to spend time together and work together, and it's just a very collegial atmosphere within our division and the Department of Neurology as a whole. So, I think it's just kind of a fun place to work, and people enjoy working together, and that goes a long way when you're, seeing a lot of patients and busy. Liking the people you work with counts for a lot.
Thank you. All right, one of the other questions that we had a couple of nights has been, is there any opportunity for a fellow to be trained on how to do neuromuscular ultrasound?
I can go first on that. We do have training in neuromuscular ultrasound. We incorporate that into our EMG lab. And so our fellows learn both common and less common ultrasound techniques in the lab.
Anybody else want to answer that?
Yeah, we at Hershey Medical Center, we also have the opportunities and it's expanding. So they will also learn additional uses of ultrasound in kind of an extended field, like how to do salivary gland injections for ALS patients like that. But yeah, the facility does exist.
At UF, we do have an ultrasound machine that we use in some cases. And we can send a fellow to a special session and training of neuromuscular ultrasound. I think there are a few of them happening in the US every year. Now some of them are canceled due to COVID though, but hopefully they're reopened soon.
At two of the faculty are neuromuscular ultrasound trained. However, we don't have an active ultrasound training program at this time.
Okay, thank you. So we'll do one more question here that we've had. For all programs, do you consider applicants from PM&R residencies?
We will consider PM&R applicants. In general, I think it's a little bit hard for a PM&R resident to do a ABP and neuromuscular medicine fellowship because there's so much neurology as part of that fellowship. But we often will have PM&R residents who come in as a fellow to do ABEM certified training and not sit for the neuromuscular medicine boards, but sit for the ABEM boards. But we will take physiatry applicants.
Thank you.
Yes, we also consider physiatry applicants for our fellowship.
The same goes for the University of Miami. We will consider, depending on the training, physiatry applicants.
And I'll conclude that at Hershey Medical Center, we do have the PMR residents. They come in order to get the ABM eligibility for certification exam. But at this point, we are accepting only residents who have completed an ACGME residency in neurology, but that can change.
Okay, thank you very much. Now, question, do we have any fellows or any of your fellows on the call tonight?
Yes, I'm a fellow from University of Miami.
Listen, do you want to talk to them about your own personal experiences?
Sure, I guess just with our program.
Yeah, that'd be great.
Sure, I can kind of give an overview of how things are. I guess my typical week is we work in line also. Though I'm the only neuromuscular fellow, I have a co-fellow who's a clinical neurophysiology fellow who works with me. 6 months I have I'm working with one of them, and the other 6 months I'm working with another as they switch with epilepsy. And it's really every morning and afternoon we're doing something different. It's a mix of course, EMG, time in the EMG lab, as well as just multiple specialty clinics. For example, today I had in the morning time in the EMG lab. In the afternoon, we had MBA clinic. We have an ALS center, so on Fridays, those are dedicated to that time. We also spend time in an afternoon in our myositis clinic. We have a Charcot-Marie Tooth Center as well. And so, and also a myasthenia clinic. And so it's really been a great experience seeing just a lot of disorders and knowing how to and learning how to manage a lot of disorders that we actually I think in general, and as residents, we don't see a lot just because of residency, and typically neurology residency is very inpatient based, and a lot of these disorders we don't get exposed to. So certainly in my experience, it's not only been a mix of, learning how to be a good electromyographer, but also learning just how to, in general, manage a lot of neuromuscular disorders that we typically don't get exposure to enough in residency.
Thank you. We appreciate you sharing that. Is there any other fellows out there that want to talk about their experiences at their institution? Well, thank you for joining us tonight. We appreciate all of your time. As we wrap this up, let me just go through a couple of announcements for you. We have the AANEM Spring Virtual Conference, which is March 2nd through the 5th. So registration is now open for that. If you are a resident or fellow, please note that you do get to attend that meeting for free. So you may want to register. That's a perfect, great opportunity. So hopefully you'll come and join us for that wonderful event. We also have the neuromuscular and EDX self-assessment exams. Those are May 3rd through the 10th. And the AAN annual meeting to be held October 13th through the 16th in Aurora, Colorado. So we are hoping for a live meeting this year. So we are planning for it to be live. Program directors, thank you for taking the time out of your busy schedules to do a presentation for us tonight. I know the residents appreciate hearing a little bit about each of the programs so they can make a well-informed decision. And for the fellows, thank you so much for sharing your personal experiences. It's wonderful to be able to hear firsthand what your experiences are as a current fellow. And residents, we thank you very much for coming tonight. We hope that you've enjoyed it. We want to hope to be able to bring this to you for many years to come. Thank you so much, everyone. Have a wonderful evening and stay safe. Goodbye.